Hello, I'm Dr. Brandt Gibson, and interesting thing as I was going through the list of some of the things we've talked about over these 63 days, today being the 63rd, I've noticed that I never talked about warts. This is a very, very common problem that we see on a regular basis in the foot and ankle. They can happen on the top of the foot, on the ankle. They also happen on the bottom of the foot. And you'll oftentimes have people talk about plantar warts. The medical name for warts is Verruca because of the appearance, which is the bumpy appearance. And when you look at a wart or a verruca on the foot or other places, typically they will have what people call seeds, where they're little black dots in the skin. And the reason why is because, like we were saying, a wart is curved like this. And so if you take the top layer off then what happens is you have the little pinholes or capillaries in those pinholes that clot to create those little black dots or the seeds in the wart. So warts are actually caused by an infection. They're not inherited. They're not anything else like that. They're actually an infection. They're a virus that causes warts. Now, the interesting thing that we found is that they do run in families in the fact that you have a tendency for them. So you can have, say, mom doesn't have them, but dad has them, and all the kids have them because there's a tendency from dad that they actually get the infection or the wart infection in that area. So how do you treat them? If you have a wart, what are some things you can do? There was a study run up in Seattle where you can actually put duct tape on it and you leave it on for long periods of time. Usually you're going to want to have it on for 2 to 3 months. It's quite a while. You leave it on 4 or 5 days. As long as you can keep it on, take it off, clean up the area, put it back on, and you just keep doing that until the wart goes away. Number 2, you can leave them alone, and sometimes over a period of 3 to 5 years, they'll just go away. The problem with warts on the bottom of the foot, the plantar warts, is because you're walking on them and you're constantly rubbing them, they don't go away as fast, and usually over time they start to spread. A lot of times people will try to freeze them off or burn them off, and that works quite well on the top or dorsum of the foot. That can sometimes work on the ankle, but it doesn't work very well on the bottom of the foot. When you have plantar warts on the bottom of the foot, they typically are unable to be burned or frozen off because of the thickness of the skin, and you're not able to get deep enough without damaging the surrounding tissues to get them to go away. So typically the way we treat these is we actually inject them with a antigen to candida, a candida antigen. What it does, it stimulates the immune system to fight off the virus, and over a period of 6 weeks, typically the warts go away. In kids, they'll just disappear and fall off. In youth, in young adult areas, sometimes they'll fall off, sometimes they disappear, sometimes they'll actually just form a callus, which is what they do in adults. They usually become a callus, and you trim the callus off and there's no wart left. Now, the disadvantage of this treatment is you're getting a shot and the shot hurts. And sometimes you'll get a significant inflammatory response because that's what we're trying to get, and it may be uncomfortable a little bit afterwards. There are other treatments that are used on this as well. I don't like the side effects of most of those treatments, so I'm not going to discuss those at this time. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 63, Verruca.